Thank you. I'm Christy Dempsey. I am the Chief Nursing Officer and President for Clinical Excellence Solutions at Ganey. Ganey partners with healthcare organizations around the country to provide solutions that enable enterprise transformation across the patient journey. So we collect data around the patient experience, caregiver engagement, safety, and clinical quality. And we look at those data and we collect it, we draw insights from that data, and then we help organizations improve based on those insights. And healthcare organizations and nurses in particular are inundated with data. We have oodles of data. And as we work to transform healthcare across the continuum, we have to not only collect data, we have to help nurses in particular understand how to understand the data, draw insights from that data, and make improvement based on those insights. Point solutions provide a modicum of improvement, but they're not sufficient to drive sustainable improvement. In most organizations, we see siloed improvement. There's somebody in charge of safety, and there's somebody in charge of quality, and there's somebody in charge of patient experience. And these silos keep us from using the vast amounts of data that we have to really drive meaningful improvement. And due to this siloed approach to data and improvement, we see organizations dilute their focus. They're focused on too many initiatives, and it causes caregiver fatigue, and that it keeps us from that sustainable improvement. We've done a lot of research at Ganey that demonstrates the interdependencies of each of these domains. When patients perceive a reliably better experience, we see reductions in length of stay, readmissions, and hospital-acquired conditions like bloodstream infections and safety scores are better. Further, the data demonstrate that the safety and quality of care influence patients' perception of their care experience. Patient experience of care and the safety and quality of care are associated with the engagement level of the healthcare workforce. And both workforce engagement and patient experience influence organizations' financial performance. So it's important to understand that there's no light between clinical quality, patient safety, and the patient experience. It's all interrelated. And as such, we have to measure in a way that acknowledges that interconnectedness and addresses the need to derive insights and base improvement efforts in a way that reflects holistic rather than siloed efforts. These improvement efforts, while grounded in data, also have to assure a compassionate and connected approach to care for both patients and caregivers. In fact, the patient experience isn't driven by being nice or making people happy, but by assuring that both patients and caregivers feel safe in care and in their practice. Our research, both quantitative and qualitative, has demonstrated the importance of a positive practice environment and the impact that nurse managers have on things like autonomy and professional practice. As we know, nurse turnover is a significant issue for healthcare organizations across the country and costs billions. Our recent research demonstrates that nurses who plan to leave their jobs within the next year most commonly cite dissatisfaction with the work environment as their reason. Job satisfaction and joy in work, quality of care, and career development opportunities are strong retention drivers among experienced nurses. But for newly licensed nurses, it's about nurse manager support, joy in work, and praise and recognition. 60% of nurses report feelings of burnout. And our data show that key drivers of resilience vary by role and tenure and shift and generation. And understanding these drivers helps to assure a targeted and data-driven approach to improving the work environment, which ultimately improves patient safety, clinical quality, engagement, and financial performance. So to summarize, data must provide the foundation for insights relative to the patient experience and the nurse and the caregiver experience. These data-driven insights must lead to improvement efforts that are grounded in safety for patients and caregivers, compassion and empathy, and the clinical quality that are the backdrop of holistic nursing care. My recommendation to the committee is that we continue to drive data collection, insights and improvement related to patient experience, clinical quality, safety, nurse and team engagement, all in an integrated way across the continuum of care in order to provide optimal patient and caregiver outcomes. It's an honor to be here. Thank you very much.
Thank you, Christy.